Good morning. Today we'll be talking about baby blues and wondering, is it the start of postpartum depression? Thank you, Dr. Senbanjo and Dr. Abiri, for being here with us today to discuss this very important topic because this month we're focusing on women and women's issues, particularly issues that have not been, properly explored. So last week we spoke about menopause, and this week we're going to be talking about postpartum depression and the baby blues. So if I can start with you, Dr. Shebanjo, can you just tell us what is it about pregnancy? What is it about giving birth that leads to what they call the baby blues? Can you explain?
Okay. Thank you very much, Dr. Pamela. Pregnancy and childbirth they are both great events in the life of a woman. But we find out that this is not so for every woman. For every woman, not every one of them access that joy and excitement attached to pregnancy and childbirth. Some of them are struggling with extreme feeling of sadness and uncertainty that usually overwhelm them and overshadow this joy that we talk about. And this is what we refer to as a mental disorder among our mothers. It can occur either in pregnancy, and we call it, it can occur in pregnancy or after childbirth. So when we are talking about postpartum blues or baby blues or maternity blue, it is a transient, self-limiting mood disorder that occur after childbirth.
Okay, can I ask? If I can ask some questions. Does it happen to women who have had a problem during the pregnancy? Maybe they've had a difficult pregnancy, or is it related to maybe having a child and having a problem birth or having a problem with the actual child itself? Or are they just normal pregnancies and so on that because when you're thinking this is happening, you think maybe this happens to people who had problems. Is that what the case is?
Well, that may be the case. They might have been having issues while they were pregnant. And now giving birth, they may have also traumatic birth, whereby they have complications while they are giving birth. Some of them might have gone through some life issues that are traumatic. And so this is when this occurs, there may be interplay between hormones, pregnancy hormone, the psychological state of the person in question, the mother in question, and the environment. And so they may come down with different mental disorder while they are pregnant or after childbirth. Sometimes, because the management of this disorder starts from early identification, and then when we identify it, we'll be able to treat. However, because of the stigma surrounding this condition, most of them, they don't volunteer information about how they feel. They may not even communicate what they are feeling with their relative or even their spouse. So they may go unnoticed while they are even attending antenatal clinic. And
Wow.
maybe their babies are admitted in maybe a neonatal unit. Then, because of the overwhelming stress, they now break down. So for the purpose of this discussion, I think we are limiting ourselves to baby blues and postpartum depression.
Yes, so I
And
think it's very interesting what you said is that if there's a stigma to it, how is there a stigma to it? And what are the early signs that people who are around these young mothers should be looking for?
well, because of the environment in which we are, when a woman made a complaint of symptoms that are abnormal, when they tell them that they are hearing what other people are not hearing, that they are feeling a persistent sadness in them, or maybe they feel strange somehow, our people may be thinking maybe they are mad. or maybe they have been attacked by spiritual powers. And sometimes there is this erroneous belief that they have to take them to traditional healer instead of taking them to the hospital. And so they end up with more problems that may even lead to their deaths without even getting a solution. Because postpartum depression itself, the reason why it's different from postpartum blues is that it's persistent. There is this persistent feeling of sadness, extreme sadness. They have low self-esteem. They feel they are incapable. They have poor sleep. They are not sleeping. And in the extreme of cases, there is this repetitive, intrusive thoughts that used to come to them. Do this. You think you are the problem. They are anxious. They may even think their partner is the cause of their problem. And sometimes it may lead to them killing their partners. And that's why it's a serious case. They may end up, because they feel they don't want to bring into the world and the baby and contribute the same problem to the baby. So they can end up killing the baby. They are unable to bond with their baby because they cannot really lactate. They cannot breastfeed. So the bond between a mother and a baby is not there. And so they feel they have not yet fulfilled the societal standard of motherhood, and they are a failure. So this contributes to their low self-esteem and loss of their identity. Most of the time they are withdrawn. They are not themselves. So they cannot even communicate effectively with their spouse or people around. And the reason most of the time why they are withdrawn is because they feel ashamed. They don't want people to judge them. And so they retreat into themselves without even telling people about what they feel.
Wow. This is terrible. Dr. Abiri, this is very painful. I mean, when you hear all of this is a time in a woman's life when she should be so joyful, when she should be filled with happiness. She's given birth to a new baby. From the psychiatric perspective, what are even though Dr. Senbanjo has explained to us, can you tell us what's the difference between baby blues and postpartum depression? What are the kind of early signs that people around should be looking out for? And when do they need to refer to the hospital or to a psychiatrist?
All right. So baby blues and postpartum depression are related, but they are clearly not the same thing. Just like Dr. Senbanjo just said, world over, the birth of a baby, and just like you, Dr. Pamela just said, is supposed to be a time when a woman is happy, full of joy, full of happiness, contentment, that she has the gifts that, a lot of people have longed for. But sometimes that's not what the tale is. And so some women are unhappy. It's probably the worst times of their lives. And so baby blues and postpartum depression are two mental health conditions that they can come down with. Now, baby blues refers to a short period of mood swings, there's sadness, there's anxiety or irritabilities that many new mothers experience shortly after childbirth. So it comes within the first few days and it peaks at about the third to fourth day of life. It lasts about, 2 weeks. And it's generally considered a normal response to the hormonal changes and adjustments that come with having a baby. The honest truth is that a lot of women who eventually go on to have, baby blues are women who had a history of premenstrual tension, so premenstrual syndrome, while, before they got pregnant. They may be women who had fears of labor, normal, natural fears of labor. Some may have poor social adjustments, and we also find that some had poor marital relationships prior to getting pregnant and even having the child. Now, on the other hand, postpartum depression is more intense and lasts longer. It's about intensity, frequency, and the distress that it causes, not just to the woman, but to the child and to the partner and probably other, family members and friends who might be around. Postpartum depression typically lasts more than 2 weeks. Sometimes it even lasts for a year after the baby has been born. And it involves more severe symptoms. The sadness is more persistent. The anxiety and the irritability are more persistent. The woman starts to have feelings of guilt or worthlessness and clearly has difficulty bonding with the baby. She just doesn't see the baby as something that she wants to hold close, breastfeed, or have anything to do with. And of course, PPD, postpartum depression, can interfere with daily functioning and at the end of the day may require professional treatment. While baby blues does not lead to postpartum depression, it is important to monitor symptoms, because if you start to notice that the feelings of sadness or anxiety persist between 2 weeks, worsen, or start to significantly interfere with daily life, it could be an indication of postpartum depression, and seeking help from a healthcare professional is definitely recommended.
Wow. Wow, wow, wow. I think that's quite a depressing or quite an upsetting thing to think about when you think about a young mother going through all of that. And I think that's why it's so important to talk about some of these areas that we don't normally talk about. This is not something that's commonly spoken about. And can I ask you why, though, Dr. Abiri? Why aren't we talking about these things? Even menopause, we don't talk enough about it. Now we're talking about things like baby blues, postpartum depression. Some people have never even heard of it. Why is that?
Well, so I think that at the end of the day, the attitude and the behavior and the perception, of course, and interpretation of mental health conditions is one major thing that keeps us not paying attention to these issues that definitely need all the attention that we can get. The attitude over time is one of silence. It's a culture of silence. It's a culture of silence that has been perpetuated over time. And of course, what we find is that we are like ostrich with head in sand. If it doesn't affect me, perhaps we shouldn't talk about it. And of course, we all know that women's issues, girls' issues, children's issues get even way less attention as compared with issues in the general public. And so people are often of the opinion that, well, you're a woman, you're not the first person to have done it before. Suck it in, learn from, how other people cope, understand how they coped, and, just get along with it. And so it's many factors. It's multifactorial, but of course, it's clearly fueled and perpetuated by our belief system, our attitudes, our perceptions, and our interpretation of mental health issues in general.
Thank you. Thank you very much. Well, that has been so interesting. Thank you. But I think what we need to look at now is, how do we identify such people? How can we find out who's at risk? Or maybe we should start with Dr. Senbanjo before we go to Dr. Abiri when you talk about risk. What are the signs and symptoms? How can we tell that this lady is having baby blues?
Thank you, ma. Before this time, a lot of people used to have this misconception that maternal mental health disorders, they are only common in developing countries. However, we have been able to get a lot of high-opening data that suggested that even in the developing country, the prevalence of postpartum depression far outweigh what they are seeing in the developed countries. They have the opportunity, whenever they have any ailments, they will quickly go to their hospital. And so they see a lot of cases. But we, on the other hand, would rather go to spiritual homes, seeing herbalists and all that, because of our belief system. And so most cases that are supposed to present in the hospital, they will rather go to churches looking for deliverance. They will go to herbalists to be healed of mental disorder. And at the end, they get worse at it. And so it's important that these women, even without them telling us anything, when they are coming for antenatal clinic, we should be able to identify them. Studies have shown that.
But what are the signs, Dr. Senbanjo? What are the signs people should be looking out for? Because even as we speak, there are a lot of older mothers, grandmothers, people who can be around such women, but they need to know what they're looking for.
When a woman suddenly becomes withdrawn, not sleeping, not able to bond with the baby, and also not take care of herself, then they should be suspecting postpartum depression. When she's avoiding the baby or telling them things that they cannot hear, they should take such a woman to hospital for medical attention rather than take such a woman for deliverance in church. Or they should not take such a woman to spiritual healer's home, where the woman will deteriorate and it may even lead to the death of the woman at the end of the day. And the symptoms will still persist. And if it's not checked, it can even kill the family members, because intrusive thoughts may be persecutory and it may be directed at any member of the family, and they can take care of that member of the family. So it's important that we should identify it. Currently in Lagos State University Teaching Hospital, there is currently an ongoing exercise that we are doing to improve our antenatal care of our pregnant women. We are using a screening tool to identify women that are at risk of postpartum depression and anxiety. And once they are picked, we usually refer them to our the other behavioral medicine so that they can be evaluated and they can have intervention. And once that is nipped in the bud, they won't have any problem coming down with such a depression after delivery. And we have a lot of them that they didn't even give history that they have a prior mental illness and they are going through depression in pregnancy. Thank you, ma'am.
Thank you so much. Dr. Abiri, do you have any other risk factors you want to add to what Dr. Senbanjo has said? That, things that people can look out for?
Well, so I always say one interesting thing that sometimes you may never even know. Again, you may never know because the pre-morbid personality of the woman may not be exactly different from what you might find post-delivery. And it's the reason why we must have a high index of suspicion. And of course, we must individualize the things that we're looking out for. Usually, if you're looking out for, baby blues, the symptoms in baby blues is likely to happen in women who are first-time mothers, who've had a stressful pregnancy or birth experience, and a prior history of mood disorders, as well as lack of social support and sleep deprivation. If you're looking at postpartum depression, of course, some risk factors include the fact that there's a prior history of mental health issues. Again, first-time mother, or maybe, having another child. Again, lack of support, stress and life events, as well as complications during pregnancy or birth. If the pregnancy is also unplanned or unwanted, or if the gender of the child is one that the woman does not wish for, largely because the family is expected. So you can imagine a woman who has had 6 female children, and then the 7th one is, again, a girl. And there's pressure from the home. Chances are, they would not be very welcoming with that baby. And so what are some of the things that we can look out for? In postpartum depression, again, the symptoms of depression can be cognitive, affecting the mind. They can be behavioral and they can be physical. So if they are cognitive or emotional or psychological, you'd find that the woman is persistently sad, tearful, or expresses feelings of hopelessness. She may lose interest in previously enjoyed activities. She may be unduly irritable or have mood swings and express feelings of guilt or worthlessness. And she may even verbalize the thought of harming herself or the baby as well. For full symptoms, there might be changes in appetite, or she may just drastically lose weight. She may not sleep well, and she may just complain of listlessness, a lot of symptoms, headaches, stomach aches, muscle pain, or just fatigue or lack of energy, which of course is not accounted for the pregnancy or accounted for by the pregnancy or the delivery. And last but not the least, behavioral symptoms in which the woman starts to withdraw from social interaction and avoids friends, families, or social engagements, and definitely has difficulty bonding with the baby, as she may feel disconnected or indifferent towards the baby, and it may lead to issues with breastfeeding or even taking care of the baby. And then we must also talk about the context of our own environment, where even after delivery, people come to your home, maybe a mother-in-law, other family members, and they expect that, you will not only take care of yourself and the child, but you'd also be tending to, all those people in your houses. All of these pressures are extreme for women. And it's important, again, like I said, that we must individualize our women. Just because some grandmother or some mother was able to successfully do it does not mean that, they have the genetic makeup or understand the peculiarities that this young woman has gone through. Thank you.
I think it's very important. And how do we, because these things are important, and we're talking about support systems and coping strategies now, because when it's true, because I remember a friend of mine who moved to the UK with her young son. She just had a baby. Her mother-in-law now came to the UK. In the UK, there's no support, no house help, no nothing. She was so depressed. She said she had to wake up in the morning, look after the baby, look after the house, cook for the mother-in-law, cook for the house. She was, it was really terrible. So how can we, prevent those things? How can we make sure, that there's support for our young mothers? Dr. Abiri?
Right. So thank you. I think that it's particularly important that we individualize people and understand that while pregnancy may be an easy journey or a road to motherhood for some, it's not the same in everyone. And so we must understand that pregnancy can be unpredictable. It's supposed to be a joyous experience, but it is not so for everyone. Some women go through so much, not just in first trimester, but second trimester, throughout the trimesters, they're struggling. Delivery is a challenge for them. And so we must see women and understand that they need a lot of extra nurturing and care even when pregnant. After delivery, of course, it's important that women get support. Again, not just after delivery. The kind of care and support that a woman gets when pregnant. Is the pregnancy one that is not wanted? Is the spouse supportive? Does she get enough food? Does she get, adequate care? Or is she in an abusive relationship even while pregnant? So we must not, lose sight of the fact that there's some women that, in spite of the fact that they're pregnant, it doesn't mean that they would still not go through domestic violence issues when they're pregnant. And so that time of pregnancy should be one that is a caring and extremely caring and nurturing time, not just, for the woman, but also putting into consideration that the little child that is yet unborn is extremely important. It's extremely important, of course, to also connect with other women who might be going through similar challenges. Support groups. There's power in groups. There's power in understanding that, oh, I am not alone, and other people their stories may also inspire me as well. Of course, very important is family support, involving partners, family members, and friends in the care plan, such that they can provide not just financial support, but emotional and practical support as well. And then last but not the least that I would like to add is that women, of course, also need to be very aware that we need to take care of our own selves. No one owes it to us. And so the first person who should take care of us is us. And so lifestyle changes, sleep well, eat right, exercise, and ensure that you visit your doctors regularly for your antenatal care as well.
Yes, thank you so much. I mean, we have next to no time at all, but I know what you said was so important. Dr. Senbanjo, in your last words, and I want to just commend the LASUTH for this move you're making to really identify and help to support our ladies. But are there any more apart from the LASUTH? Are there any support groups or community resources available for struggling mothers? Are you aware? And perhaps you can also wrap that up in your last words for our listeners, Dr. Senbanjo.
The support group that was created for these women in LASUTH is a multi-departmental kind of support group between the obstetrician and the psychiatrist and clinical psychologist. So when these women come, we have the clinical psychologists who take their time to counsel them, give them something like cognitive behavioral therapy to help them to see the other side of life and that they have every reason to be happy. And most of them, after going through this counseling, when we see them, there are usually a lot of changes in them. And we also give them the ability that they can also call any one of the team member at any point in time when they are having difficulties so that they can be sorted out. So these are the things that we are doing for them in Ikeja House, LASUTH.
Okay,
and
thank
we
you very
also
much.
hope that this also go to other centers in Lagos and all over Nigeria, because most people, they have not really, I don't know how to put it, they have not really given priority to this when antenatal care and maternal care is involved.
So I think that perinatal mental health is extremely important, and it should be getting all the attention that it deserves. You know how we say that when a woman is well, the nation is well. So again, women's mental health deserves all the attention that it can get. Thank you.
Thank you very much. Thank you for watching. Please like, share, and subscribe for new video updates.